Neomycin-Polymyxin-Gramicidin Drops are used to treat eye infections caused by bacteria. This medication contains 3 antibiotics that work together to stop the growth of bacteria in the eye. It is important to note that this medication only treats bacterial eye infections and will not work for other types of eye infections. It's crucial to use this medication only as directed by your healthcare provider to avoid unnecessary use or overuse, which can lead to decreased effectiveness. The daily dosage and optimal timing for taking this medication should be determined by your healthcare provider based on your specific condition. When using Neomycin-Polymyxin-Gramicidin eye drops, it's important to wash your hands before applying them. To prevent contamination, avoid touching the dropper tip or letting it come into contact with your eye or any other surface. If you wear contact lenses, do not use them while using this medication. Make sure to sterilize your contact lenses according to the manufacturer's directions and consult your doctor before using them. To apply the drops, tilt your head back, look upward, and pull down your lower eyelid to create a pouch. Hold the dropper directly over your eye and insert 1 drop as instructed by your doctor, typically every 4 hours. After applying the drop, look downward and gently close your eyes for 1 to 2 minutes. Place a finger at the corner of your eye near the nose and apply gentle pressure to prevent the medication from draining out. Avoid blinking and rubbing your eye. If directed, repeat these steps for your other eye. After each use, replace the dropper cap and do not rinse the dropper. If you are using another type of eye medication, wait at least 5 to 10 minutes before applying Neomycin-Polymyxin-Gramicidin drops. Use the eye drops before eye ointments to allow the drops to enter the eye. It's essential to use this medication regularly to get the most benefit from it. Try to use it at the same times each day to help you remember. Continue using it for the full prescribed time, even if your symptoms improve after a few days. Stopping the medication too early may cause the infection to return. Remember to inform your doctor if your condition persists or worsens. When applying Neomycin-Polymyxin-Gramicidin drops, you may feel a temporary stinging or burning sensation in your eyes for a minute or 2. You may also experience eye discomfort, redness, or temporary blurred vision. If any of these effects last or worsen, it's important to contact your doctor or pharmacist right away. It's essential to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. Using this medication for prolonged or repeated periods may increase the risk of a new fungal eye infection. It's crucial to not use it for longer than prescribed and to reach out to your doctor if you notice any new or worsening symptoms. While a very serious allergic reaction to this drug is rare, seek medical help immediately if you notice any symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before using Neomycin-Polymyxin-Gramicidin drops, make sure to inform your doctor or pharmacist if you have any allergies to neomycin, kanamycin, or gentamicin. This product may also contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. It's important to also inform your doctor or pharmacist of your medical history, especially if you have other eye problems. After applying this medication, your vision may become temporarily blurred or unstable, so it's best to avoid activities that require clear vision until it's safe to do so. If you are pregnant, this medication should only be used if clearly needed, so be sure to discuss the risks and benefits with your doctor. It's also unclear if the medications in this product pass into breast milk, so consult your doctor before breastfeeding. When using Neomycin-Polymyxin-Gramicidin drops, it's important to be aware of potential drug interactions. These interactions can affect how the medication works and increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share this with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Neomycin-Polymyxin-Gramicidin Drops. Always consult with a healthcare professional for personalized recommendations. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222, and in Canada, residents can contact a provincial poison control center. As for the daily dosage and optimal timing of Neomycin-Polymyxin-Gramicidin Drops, it is important to follow the instructions provided by your healthcare professional. Typically, the drops are applied to the affected area as directed, usually a few times a day. It is important to use the medication regularly in order to experience its full benefits. Do not give this medication to anyone else. These drops have been prescribed specifically for your current condition. Once your treatment is finished, discard any unused medication. Do not save it for later use, unless your doctor instructs you to do so. If you forget to take a dose, take it as soon as you remember. If it's close to the time of your next dose, then just skip the missed dose and continue with your regular schedule. Don't take a double dose to make up for the missed one. It's important to stick to the recommended dosage and timing for the best results. When using Neomycin-Polymyxin-Gramicidin Drops, it's important to store them at room temperature and away from light. If the solution turns brown or cloudy, or if it contains particles, it should be discarded. It's essential to keep all medications away from children and pets. When it comes to discarding the drops, it's important not to flush them down the toilet or pour them into a drain unless specifically instructed to do so. Instead, the product should be properly discarded when it is expired or no longer needed. It's best to consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.